Illnesses that almost seem inevitable. Here to break down the main viruses currently circulating around and how to deal with them is Dr. Drew Watson, a sports medicine physician with UW Health Kids in Madison. Dr. Watson, thank you so much for being here this morning.
Good morning. Thanks for having me.
So with all of these viruses going around, such as the flu, COVID, and RSV, how can young athletes and children prevent these kinds of viruses?
Yeah, I think we're seeing a lot of all three of these. And in some ways, we were kind of protected by the things we've been doing for the last couple of years to reduce the risk of COVID, but they have the same beneficial effects against a lot of respiratory infections. So things like washing hands, staying away from school or away from sports if you have symptoms, maybe minimizing large gatherings of people indoors. And then in terms of flu and in terms of COVID, getting vaccinated is probably the most impactful thing that we can do for young athletes and their families.
Right, and the reason we ask about young athletes is because of the risks that can come with participating in sports when having these sicknesses. So could you touch on that and how these young people and their families should be managing these viruses?
Yeah, I think a couple of the big lessons that we learned from COVID. One is that when young athletes lose access to sports, it has really significant negative physical and mental consequences for them. So being able to prioritize participation in sports, even in the midst of these ongoing viruses, I think is really important. One of the other things we learned is that it's really pretty rare for athletes to transmit viruses to each other during competition on the court, on the ice, or on the field. It really does seem to be that young athletes tend to acquire these from community contacts, household contacts, and within athletics, more around things like locker rooms or team meetings. And so, as we think about prioritizing all the benefits that sports provide, it really should be about trying to reduce the risk of acquiring them outside of the field and the ice and the rink, but still facilitating their participation so they can see all the benefits sports provide.
Sure, definitely all important things to keep in mind there. And lastly, during the winter season, it seems like being sick kind of just comes along with it. So when do you suggest that it's time to seek professional advice or testing?
Yeah, I mean, I think even before COVID, we all kind of had experiences with relatively mild colds that tend to go around among kids. I think if you're having fever for several days, I think if at any point children or young athletes are having issues with shortness of breath or difficulty breathing, or honestly, as parents of kids, if we just don't feel good about how they look, those are times to be able to reach out to your healthcare provider or be seen so that they can be evaluated further.
All right, Dr. Watson, thank you so much again for being here and for sharing your advice with us.
Thank you.